very much for having me. Just like to do a few things and touch on all of the bases that were just mentioned. I'm a primary care physician. I've trained and went to school at UCLA. I'm definitely in favor of Prop 46 on all three bases. The first I will address is the computer data that we have access to. We've implemented it in our practice approximately 5 years ago. It is definitely a good thing. It is not invasive to the patients. There's people out there, unfortunately, that do abuse medications, either for their own personal use or they create a stockpile to sell. This allows us information to see who has been doctor shopping. It's very quick, very easy, it's very secure, and it has to, the healthcare provider needs to be trained in order to access it. We've used it numerous times and probably used it last week, and in a very positive way. So very easy, very simple, and to have all physicians that are writing controlled substances would be a very positive and very safe thing for the general population of patients. The second issue I want to talk about is the mandatory drug screening. The mandatory drug screening is definitely a very, very small inconvenience to physicians to perform and will give so much payback. Unfortunately, physicians, as you have heard, are not immune from normal abuse issues, whether it be alcohol or drugs, and they have access to them all. To implement a program like this, just basically makes sense. It could be performed very easily. We are mandated for our licenses to do continuing medical education, and every 2 years we have to be caught up. But if we have to be caught up in order for our knowledge base, and then not to apply something as drug testing, and if we're altered during the times of making a decision, it really doesn't make any sense. So I think that's a big point. Physicians, one thing we can all count on is we're all in the population, and the population will become patients sooner or later. Even physicians become patients, or physicians' families. Physicians would not go to other physicians if they knew they were drug impaired, and unfortunately, the policing of our own has been really, in my opinion, unsuccessful. So I think that this, again, is a safety measure and definitely will help. I do want to address the third point to Proposition 46, which is the MICRA issue. As mentioned, it was installed in 1975 at a $250,000 cap. It has not been raised in the 38 years. I had a patient, unfortunately, going for an elective procedure, and through the process of anesthesia, had to be awakened, was not quite there. Patient, unfortunately, was extubated, vomited, aspirated, became hypoxic, coded, and this young person in their 20s was subject to neglect, malpractice. They had won, but remember the patient's family always coming in and saying, I have this 22-year-old male that I have to take care of for years to come. And looking at the money they received from that was certainly not enough to put them back into this healthcare system that she trusted in so much. So that's a very important point. Doing the research for this, coming down and talking, it was very interesting, and you won't hear this from the opposition. First of all, it is guided by the insurance industry. The insurance industry factually has put $60 million to defeat this issue. That tells me a few things. One is that it's a filthy rich industry, and it tells me also they're willing to spend a lot of money because they know it's going to hurt them as far as their profits go. In regards to that, thank God there's Prop 103. Most physicians are being fed information by our medical societies, mainly the CMA, that their rates will go through the roof. They will not be able to afford to practice medicine, and the scare tactic is out there. I just want to go on record as, in my opinion, thinking that is, and stating that is wrong. We do have Prop 103, which will actually, thank heavens we have Prop 103, is so the insurance industry cannot raise the premium to the physicians, but yet will suffer profit loss, which they clearly don't want to do, in the tune of $60 million. All in all, I think Prop 103 on all three facets are good for people and the patients, and that's what it's about. It's not about the physicians, it's not about the system, it's good for patients, and I encourage everyone to, the Consumer Watchdog has brought this proposition to us, is that we have to take it home now and get out and vote, and a vote of yes on 46 is what I'm gonna vote. Thank you.
Thank you, Dr. Nordella.
Della, why aren't there more doctors speaking out about this?
Oh, I remember. I'm sorry. Go ahead. Go ahead. You write it down.
Don't know, but I think you can speculate that it has to do with maybe the physicians don't want to, it could be a pattern of referrals they're getting from other doctors, and that this doctor sends them business. It could be the fact that, you know, they just want it to go away, and usually by nature, doctors really aren't confronters. That's why, in my opinion, the insurance industry is kind of doing what they're doing. It's a group of people they kind of abuse. So, you know, again, it's just speculation, but that would be my guess.
Thank you. And